Kia ora, I'm the avatar of Gay Barton, General Manager for Drake New Zealand. Welcome to the Drake Medox team. Our field staff are very important to us because our success has been built on the hard work of people like you. The purpose of this video is to introduce you to Drake Medox and give you some information about us and what we do, as well as providing some information about your employment. Drake Medox is part of the international recruitment company Drake International. The company started in Canada in 1951 and now has offices all around the world. Drake Medox supplies temporary and permanent home care and nursing staff to clients. Our philosophy. Drake Medox's philosophy in delivering healthcare services is to promote independence, offer services that meet or exceed sector standards, promote access to our services, recognise our responsibilities to Māori through the principles of the Treaty of Waitangi, actively embrace service improvement and aim to be the best, recruit and enable our employees to be the best they can be, engage with our funders, clients and other agencies using a partnership model that works towards common and agreed goals. Our values are easy to remember. Think rapid, respect, agility, achievement, pride, passion, innovation, integrity. Drake. Our workforce is formed by field staff employees and consultants. You are a field staff employee working in the field and will provide clients with the care they require. Our consultants operate from the office and are recruiting and responsible for placing field staff employees, you, with clients, processing your timesheets, and are the people you contact if you have a problem or a concern. Now let me introduce you to the Drake Medox health team. Charlotte Holiday and Sanjana Maharaj.
Hi, I'm Sanjana Maharaj's avatar. I am the health team leader and responsible for recruiting temporary bureau registered nurses. I'd like to welcome you to the team and I look forward to working with you all.
Hi, and I'm Charlotte Holiday's avatar, and my role is healthcare recruitment consultant. I recruit registered nurses and healthcare assistants for casual bureau work, and I will give you all the information you need to know about working for Drake Medox. Our service and our clients. Our clients include public hospitals funded by the DHBs and private hospitals, schools, practices, hospices, prisons, aged care facilities, pandemic response facilities, and private clients. We provide nurses, healthcare assistants, disability support workers, aged care and allied health staff as required by our clients. Working for Drake Medox. Now, let's talk about your employment. Your employment with Drake Medox is outlined in your employment agreement and company policies and procedures. This video provides information regarding our expectations of you as our field staff employee. Your role. The tasks you are required to do will vary depending on the client and your role. Key tasks may include standard care, such as personal care, helping with dressing, undressing, showering, bathing, toileting and personal hygiene, medication administration, documentation of observations, complex care, any other tasks determined by the charge nurse or supervisor that is within your scope of practice, nursing, healthcare assistant and mental health assistant. Your responsibilities include arriving at work on time or advising us as soon as possible if there is something urgent that you need to attend to or you're running late so we can tell our client, completing assigned tasks, attending pre-arranged client appointments as per your daily schedule, communicating effectively with clients, reporting any adverse events, incidents, accidents, near hits, hazards or any other concerns to your consultant, attending Drake Medox training sessions, adhering to Drake Medox policies, accurately completing your timesheets, keeping your availability updated at all times. Please note, not turning up to work and not telling us constitutes serious misconduct. Drake Medox conducts spot checks to ensure field staff are working the hours they are paid to work. Disciplinary action will be taken against staff that misled us about the hours that they work. Your rights. Alongside your responsibilities, you also have rights. You have the right to receive a timely response to all verbal and written communication requests, have your concerns or complaints dealt with fairly and promptly, have your own privacy respected, and in saying that, we advise you do not give your clients or patients your personal details, and to be treated with respect and dignity, meaning you're not subject to abuse or harassment, including gender, race or religious discrimination, physical or verbal abuse from clients, sexual harassment, having your health or safety compromised by being asked to complete tasks which are not in your job description. You must notify your consultant immediately of any conduct that subjects you to abuse or harassment. Clinical Code of Conduct. Each registered nurse, midwife, enrolled nurse and healthcare assistant shall act at all times in such a manner as to justify public trust and confidence, to uphold and enhance the good standing and reputation of their profession, and to serve the interests of society, and above all to safeguard the interests of individual patients and clients. Each registered nurse, midwife, enrolled nurse and clinical assistant is accountable for his or her practice and in the exercise of professional accountability shall act always in such a manner as to promote and safeguard the well-being and interests of patients and clients, ensure that no action or omission on his or her part or within his or her sphere of influence is detrimental to the condition or safety of patients and clients, take every reasonable opportunity to maintain and improve professional knowledge and competence, acknowledge any limitations of competence and refuse in such case to accept delegated functions without first having received instruction in regard to those functions and having been assessed as competent. Work in a collaborative and cooperative manner with other healthcare professionals and recognise the respect to their particular contributors within the healthcare team. Take account of the customs, values and spiritual beliefs of patients and clients. Make known to an appropriate person or authority any conscientious objection which may be relevant to professional practice. Avoid any abuse of the privileged relationship which exists with patients and clients and of the privileged access allowed to their property, residence or workplace. Respect confidential information obtained in the course of professional practice and refrain from disclosing such information without consent of the patient or client or a person entitled to act on his or her behalf, except where disclosure is required by law or by the order of a court or is necessary for public interest. Have a regard to the environment of care and its physical, psychological and social effects on patients and clients, and also the adequacy of resources. And make known to appropriate persons or authorities any circumstance which could place patients or clients in jeopardy or which militate against safe standards of practice. Have regard to the workload and the pressure on professional colleagues and subordinates and take appropriate action if these seem to be such as to constitute abuse of the individual practitioner and or to jeopardise safe standards of practice. In the context of the individual's own knowledge, experience and sphere of authority, assist peers and subordinates to develop professional competence in accordance with their needs. Refuse to accept any gift, favour or hospitality which might be interpreted as seeking to exert undue influence to obtain preferential consideration. Avoid the use of professional qualifications in the promotion of commercial products in order not to compromise the independence of professional judgment on which the patients and clients rely. The Code of Health and Disability Service Consumers' Rights, the Code, establishes the rights of consumers and the obligations and duties of providers to comply with the Code. It is a regulation under the Health and Disability Commissioner Act. Under the Code, consumers have rights and providers have duties. The 10 rights of consumers are: 1. Right to be treated with respect. 2. Right to freedom from discrimination, coercion, harassment and exploitation. 3. Right to dignity and independence. 4. Right to services of an appropriate standard. 5. Right to effective communication. 6. Right to be fully informed. 7. Right to make an informed choice and give informed consent. 8. Right to support. 9. Rights in respect of teaching or research. 10. Right to complain about a provider in any form appropriate to the consumer. Palliative care. Only experienced staff will be placed with palliative care clients. In addition to providing palliative care, consider the cultural, spiritual, and religious needs of the client and their family, and follow their lead on how they would like you to support the client. Unexpected death. If you are present at the death of a client, call the Drake Medox office, call 111 unless other arrangements have been specified. Do not contact the next of kin. If alone, do not touch the client other than to check for a pulse. For the sake of dignity, you may adjust clothing. Stay at the client's home until family or a senior member of the Drake Medox team arrive. A prayer for the deceased is not appropriate unless previously discussed with the family. However, if you require this for your own comfort, please do so quietly and discreetly. It is acceptable for you to participate in cultural and religious activities following the death if the family invites you and this does not make you uncomfortable or conflict with your own beliefs. Health Information Privacy Code. Client Health Privacy. This code consists of 12 rules that constrict the way we collect and use confidential client information. Drake Medox and our employees must comply with these rules. Field staff are given information about a client or patient's health that is sufficient to ensure the well-being of the client and the safety of the field staff and no more. At times, you may see or hear more information about the client, patient, or their family. This information must be kept confidential unless it puts you, the client, or any other person at risk. Documented client and patient information must be kept in a safe place. For example, not left in your car or around your home where others might see it. You sign a confidentiality agreement as part of your Drake Medox employment agreement. Any breach of client or company confidentiality is considered serious misconduct, and disciplinary action may be taken, including termination of employment. Dress code. All field staff must wear a Drake Medox scrub top which will be provided. Our recommended dress code is, so for women, clothing and footwear, you'll wear a Drake Medox scrub top, black or navy skirt or tailored trousers, non-slip fully covered closed-toe black shoes, black or neutral stockings or tights. For men, Drake Medox scrub top, black or navy tailored trousers or long shorts, non-slip fully covered closed-toe black shoes. Jewellery and presentation. A flat wedding band only is permitted to be worn while on shift. Only stud earrings or sleepers may be worn. No nose or facial piercings are permitted. Long hair must be tied back. Makeup must be kept to a minimum. Clothing must be clean and well maintained. Fingernails should be kept neat and clean. All cuts and abrasions must be covered with a clean, coloured band-aid. In cooler months, please wear non-visible undergarments. No long-sleeve t-shirts or thermals to be worn under the Drake Medox scrub top. Your ID badge must be visible and worn at all times. Professional support. Your consultant is the person you will deal with most frequently. It is important that you establish a strong working relationship with your consultant and inform them of any difficulties you've had in completing an assignment or any personal circumstances that may affect your ability to do your job safely. If you require support, please talk to your consultant as soon as possible. If the situation is of a serious nature, we may be able to assist you with the provision of a qualified counsellor. Methods of communication. Drake Medox uses a variety of communication methods. Phone calls are always the best way to contact us to ensure your message is communicated and there is someone answering our phone 24 hours a day. Using email and text messaging does not guarantee that your message has been received, and both should not be used to communicate messages after usual business hours. Phone. Please use the phone for any urgent messages or inquiries. For example, if you can't make a shift, call 0800 633 699. Texting. We may communicate with you via text as it means we do not interrupt you while you're working, and we can communicate with many FSEs at one time. Email. We can arrange for you to receive emails, but please remember to keep the client privacy and please make sure no one else in your household has access. Person to person. We mainly meet in person for training, while performance reviews may be conducted online. Communicating your availability. Updating your availability online is mandatory. Please remain contactable once you have given your availability, as some clients require staff at short notice. If your availability is not up to date, you will not be contacted for shifts as our consultants are not aware that you won't work. Please let us know if you have a preferred method of contact, for example, phone, email or text. Let us know when you're available so we can provide you with work. And if you have a preference, so for example, mornings only or only afternoons and night shifts, we will always try to meet them. And just something to note, please stay contactable until the evening if you want work for a night shift. We try not to call you before 4 p.m. the following day for a night shift. If at any stage you do not want an early morning call at 5:30 a.m. for a morning shift, please do this by calling the after hours team the night before to cancel your morning availability. When you are no longer available, we do not allocate shifts to you. Updating your availability. You can do this by phone or online. Please don't forget to let your consultant know if your availability changes. By phone, call the health team at the beginning of each week. Online, submit your availability at least 48 hours in advance or by Thursday for weekend availability. Go to www.nz.drakeonline.com. Enter your user ID, your login, and the password, which is Drake Medox 1 or lowercase. Click on the Options tab. Click Available Schedule. Check you are in the right month. Update your shift selection by ticking each shift of each day you're available to work. Please do not use the multiple shifts checkbox. Click the Save Availability button at the bottom of the calendar. If required, add or edit the next month's availability by selecting the month at the top of the calendar, click Apply and repeat the procedure. Assignments. Starting an assignment. While you're on duty, you not only represent yourself, but also Drake Medox. Therefore, it's important to be professional at all times, and we ask that you remember the following. Dress appropriately. Make a good impression by being punctual. Always arrive 10 minutes early to an assignment. If you're running late, give the Drake Medox team a call so your consultant can let the client know. On your first shift, always request a quick orientation of key items, for example, where the fire exit is and communication booklet. Upon arrival at your assignment, be proactive immediately. Check out your specific duties or areas of responsibility. Notify Drake Medox if there are any alteration in the assignment by the client, such as a shorter shift or a cancellation. Do not leave the assignment until you have spoken to your consultant. Do not leave an assignment early or before your relief arrives without notifying Drake Medox first. If you're unable to complete your assignment, contact your consultant. If there is an issue on a shift, notify your consultant as soon as possible. If any incident occurs on shift, ensure Drake Medox is advised within 24 hours of the incident occurring and forward a copy of the adverse event form to Drake Medox. While on assignment, you are part of that team. Be present, be helpful, and be responsive. Your practice must comply with the Drake Medox Code of Conduct and the Code of Health and Disability Services Consumer Rights. Cancelling your assignment. Once you have accepted a shift, we expect you to complete it unless an unexpected situation arises. If you are sick and unable to undertake your assignment, notify Drake Medox immediately. For ongoing shifts, you are required to give 5 days' notice for any shift cancellations. On occasions, a pre-booked shift may get cancelled. Some of the reasons shifts can get cancelled are: patient was discharged, own staff picked up the shift, or the surgery got cancelled. You'll be advised of a shift cancellation via text or phone call. If you are cancelled from your shift by Drake Medox or the client, you will get 1 hour's notice for a morning shift and 2 hours notice for an afternoon or night shift. If you are not given this notice period, you will be paid for 4 hours work. If you arrive at work and are told your shift has been cancelled, please call us on 0800 633 699. The client will either ask you to work in another ward for 4 hours or send you home and you will be paid for 4 hours. Please ensure you complete a timesheet if you need to be paid for 4 hours for a cancelled shift. End of assignment. When you are due to finish an assignment, check in with your consultant to discuss what your next role might be. Working at Middlemore Hospital. Once your profile has been approved by Middlemore, you will attend an induction day which happens there once a month. After the induction, you'll be booked in for an orientation shift and then you can start working as a healthcare assistant at Middlemore. For registered nurses, working at Middlemore, you will also need to complete online training and a clinical portal training before you can start bureau shifts. Health and safety. Drake Medox has a legal responsibility to provide and maintain a safe and healthy working environment in line with the Health and Safety Work Act 2015. You also have responsibilities around health and safety, such as working in a safe way, participating in hazard identification and management, using safe and appropriate client handling techniques, using personal protective equipment, reporting any unsafe conditions, new hazards, accidents, incidents, or near misses to your consultant. Infection control. Infection is caused by microorganisms such as viruses, bacteria, fungi, and parasites. Transmission of infection can be reduced by using standard precautions such as hand hygiene and use of personal protective equipment, PPE. Drake Medox complies with the Ministry of Health guidelines and the Health and Hygiene Code of Practice 2013 Auckland Council in their management of notifiable, communicable and infectious diseases. Please visit www.health.govt.nz and aucklandcouncil.govt.nz for reference. Hand hygiene. Hand washing is one of the most effective methods of preventing the spread of infection. Make sure you wash your hands on entering and leaving work, before and after all physical contact with a client, before preparing or serving food, before and after putting on protective gloves, before and after handling client care devices such as urinary catheters and respiratory equipment, after performing personal cares, after handling any equipment or materials contaminated by bodily fluids, when dealing with clients with an infectious disease, after using the toilet, and after blowing your nose or coughing and sneezing into your hands. How to wash your hands. Remove all jewellery and pull up long sleeves. Wet your hands and wrists before applying soap. Wash your hands with soap for at least 20 seconds, being sure to include the backs of your hands, web spaces between your fingers, wrists, thumbs and fingernails. Rinse and inspect your hands after washing, especially your fingernails. Turn off the tap, preferably using your elbow or paper towel. Thoroughly dry your hands with a paper towel. Do not flick the water from your hands. When washing your hands, liquid soap is the best choice as it is effective, causes less skin irritation, and doesn't encourage the development of resistant bacteria. Note: frequent hand washing may dry out your skin. This can be mitigated by using regular hand lotion. When using alcohol-based hand rubs and gels, apply a small amount of gel or rub to the palm of one hand. Rub hands together. Cover all surface of hands and fingers, including around and underneath fingernails. Continue rubbing until the alcohol dries, which should be around 15 to 20 seconds. If putting on gloves after, ensure hands are completely dry. Personal protective equipment, PPE. You will be provided with PPE such as gloves and aprons. Remember, always wash your hands before and after putting on protective gloves. Wear protective disposable gloves when you are likely to encounter any blood or other bodily fluids, or when handling non-intact skin. Remove gloves from the wrist and pull them inside out as you take them off. Wear a mask for sustained direct contact with a client who is coughing. Wear an apron if needed to protect yourself against blood or other bodily fluids. Dispose of all PPE contaminated with blood or body fluids in a securely tied plastic bag in the appropriate rubbish bin. Needles and sharps. You may have a client that uses needles or other medical sharps. Contaminated sharps pose a potential health and safety issue. Remember, do not separate needles from syringes or recap needles unless a recapping device is used. Ensure all empty or partly used vials, ampoules, syringes and needles are disposed of in the sharps container provided. If you're accidentally injured with a used needle, you must flush and wash the area under a cold running water, wash again with soap and water, dry and apply a waterproof plaster, phone your clinical coordinator to file a report and check the client records to verify any risk of serious infection or communicable or notifiable diseases, and contact your GP for further advice. Splashes and spills. Remember, contain the spill by blocking off the area until cleaning is complete. Put on disposable gloves. Wipe up the spill as much as possible with paper towels or other absorbent cloths. Clean with soap and water. Disinfect with an appropriate disinfectant solution. Disinfect all cleaning materials such as mops, brushes and rags, and then allow them to dry. Remove gloves and dispose of them in securely tied bags with any other disposable cleaning materials and place in the household rubbish. Thoroughly wash your hands with soap and water. If you are splashed by blood or other body fluids, wash the area thoroughly with soap and cold running water. Phone your clinical coordinator to file a report and check the client records to verify any risk of communicable diseases. Waste disposal and line. Remember, flush solid waste down the toilet. Dispose of dressings, tissues, nappies and other disposable items contaminated with blood or bodily fluids in a securely tied plastic bag in the appropriate rubbish bin. Use gloves to handle linen soiled with blood or body fluids and wear an apron if necessary. Bed linen should be folded in on itself before removing from the bed to avoid dripping. Wash soiled linen in the washing machine separately from any other laundry. Hours of work. As part of our commitment to the health and safety of our employees and to the provision of quality employees, we encourage you to manage your workload wisely, taking into consideration your personal health, family time, and personal restorative time. It is also our responsibility to consider health and safety and your workload when placing you into assignments. The guidelines for safe working hours include working no more than 96 hours per fortnight, averaging 48 hours per week, averaging at least one day, 24 hours off per week. Where you work shifts of 10 hours or more, you must take a subsequent break of at least 10 hours before the start of your next shift. You must have a 24-hour break between shifts when changing from an awake night duty to a morning or afternoon duty. Additional hours. You must get approval from your consultant prior to working any additional hours. Note that additional hours worked that you have not been approved may not be paid. Timesheets. You must complete a timesheet to get paid. You will be paid for the hours you work and have entered onto your timesheet. Your pay will be deposited into your nominated bank account on the Friday of the following week. Note, Drake Medox takes timesheet fraud very seriously. We conduct spot checks to ensure field staff are working the hours that they have agreed to. Any issues will be investigated. Timesheets are used for every shift, and you must fully complete your timesheet daily, with each shift entered as it was worked. Complete your hours using 24-hour time. For example, 5:30 p.m. is 17:30 and 9:45 a.m. as 09:45. Use a new timesheet for each shift unless you're in an ongoing assignment with the same client. If you are moved between wards and units on a shift, use a separate timesheet for each ward or unit. Timesheets must not be filled out in advance. Ensure you include the time for breaks, for example lunch. If you're unable to take a break in negotiation with the charge nurse or duty manager, please make sure the client initials the extra time worked. Clearly write all required information on your timesheet, sign it, and ensure your client signs it too. Your timesheet must be submitted to Drake Medox by 10 a.m. each Monday. You can submit your timesheet using one of the following methods. Scan and email to clinicaltimesheets@nz.drakeintl.com. Fax to 09525 0446 or deliver to the Drake Medox office in Penrose. The after hours box is on the side of the building. Payroll is processed Monday and Tuesday. Payslips are emailed on Thursday. Please ensure you've checked your payslip and let us know by 4 p.m. on Thursday if you think there are any errors with your pay. Your pay will be in your account by Friday morning. Accessing payslips. When you sign up with Drake Medox, you should receive an email from Datacom advising you your account has been set up and asking you to create a password. Please make sure you check your spam and junk box if you didn't receive this to your inbox. To access your payslips, visit datacomdirectaccess.co.nz/login. Username is usually your email address and the password you choose. Now let's talk about leave. When requesting annual leave, Friday 10 a.m. is the cut-off time for all annual and day-in-lieu leave requests. You need to contact your consultant at least 5 days before you apply for annual leave and you must apply for this leave in writing or via email. Public holidays. You may be required to work on public holidays. Please note, if you usually work on a day that is a public holiday and you are not required to work, you will be paid as usual. If you don't usually work on a day that is a public holiday, you will not get paid and you will not get time in lieu. If you don't usually work on a day that is a public holiday and you are asked to work, you will be paid time and a half for the hours worked, but will not get any time in lieu. If you usually work on a day that is a public holiday and you are required to work, you will be paid time and a half for the hours worked and get time in lieu. Days in lieu. Contact your consultant if your usual workday falls on a public holiday. If you are given time in lieu, it means you can take time off work and get paid for it without losing a day's annual leave. Sick leave. From time to time, you or your family may be sick, or you may have had an emergency to deal with. If you're unable to work your shift, please contact your consultant or the office as soon as possible. Please note, sick leave is only available after completing 6 months of work with Drake. Due to the nature of your work, you are asked to not come into work if you feel unwell. In this case, you will need to take sick leave. If you have no sick leave owing, you will need to take annual leave or leave without pay. If you are absent due to illness for 3 or more days, you must get a medical certificate from a doctor. You must tell your consultant if you are on sick leave due to an accident or have applied for ACC. If you have had an injury and were paid by ACC, you will need a medical clearance certificate from your GP before you can start work again. If you are awaiting a COVID-19 test result, please let us know and do not go to work. Bereavement leave. Bereavement leave is only available after completing 6 months with Drake. Contact your consultant or the office as soon as possible if you need to take bereavement leave. The amount of time you can take off depends on your relationship with the person who has died. Please refer to your employment agreement. Your consultant may request that you provide written proof of the death, for example, a death certificate or a death notice. Performance appraisal. All field staff have an online annual performance appraisal. The aim is to continually improve our services and to help you perform your duties to a high standard. This is an opportunity for you to tell us how you think you are going and if there's anything we can do to assist you in your role. You may also have some feedback for us. For example, you may have identified something we can improve on. Opportunities for training and self-development. We offer weekly training for healthcare assistants in our office on Wednesdays at 10:30 a.m. Please ensure you take advantage of the free training. If your CPR is coming up for expiry, contact the Drake Medox team to book in a refresher course. Various training models are also offered for nurses. Please keep reading our Drake Medox In Touch, our monthly newsletter, for training updates. Misconduct. Engaging in any of the following activities is considered serious and may result in disciplinary action or immediate dismissal. Please speak to your consultant if you have any concerns. Work hours and timekeeping. Failing to show up to work without advising us, avoiding duties and/or refusing to complete duties expected of you without discussing with Medox, misrepresenting times of service or distances travelled on your timesheet, or deliberately falsifying information, inappropriate communication, gossiping about clients or about other Drake Medox employees, inappropriate discussion of your personal problems and involving your friends or family into the workplace, breaching client or company privacy and confidentiality. Unacceptable behaviour. Expressing contempt or demonstrating prejudice for a client's religious beliefs, cultural background or person. Using insulting or offensive language. Any form of verbal or physical assault on a client, colleague or employee, including any form of sexual harassment. Watching TV or spending too much time on the phone when you should be working. Unauthorised or inappropriate use of the internet or email at the client's facilities. Deliberately violating any of Drake Medox policies or guidelines. Smoking, alcohol and drugs. Smoking or vaping while working, or smoking or vaping outside of designated areas. Working while under the influence of alcohol or non-prescribed drugs, or bringing alcohol and drugs to clients' premises. Please check with your health professional if you are taking prescribed drugs to check they don't impair your ability to work. and advise your consultant if prescribed drugs may affect your performance. Money. Accepting money or goods from a client or getting involved in clients' financial affairs except as specifically authorised and approved. Discussing what you are being paid with clients or other field staff. The Treaty of Waitangi
Te Tiri o Waitangi
and the Nursing Council. The Nursing Council is committed to ensuring the Treaty of Waitangi is instilled into the values of the organisation and is fundamental to the way in which the Council undertakes its statutory roles. As a regulatory authority independent from the Crown, the Nursing Council have a responsibility to work with the Iwi and Maori to give effect to and realise the promise of the Treaty of Waitangi. With a specific focus on the nursing profession, the success of a council will be shaped by the ability and capacity to form a range of relationships with Iwi and Maori. Through convention, the articles of the Treaty of Waitangi have been interpreted and expressed through a set of principles. The principles that the Council considers relevant to its work, and as a consequence to your work, are premised on the most recent Waitangi Tribunal claim, the Health Services and Outcomes Inquiry. The enhanced set of principles provide deeper clarity and guidance. Self-determination.
Tino Rangatirangatanga.
The principle of self-determination. This provides for a Maori self-determination. This requires the Council to work with the partners in the design, delivery and monitoring of their relevant statutory work. Partnership.
Atuitanga.
The principle of partnership requires the Council and Iwi Maori to work with each other in a strong and enduring relationship. Equity.
Mana Torite.
The principle of equity. This requires the Council to commit to achieving equitable health outcomes for Maori through the functions that it's responsible for. Active protection.
Rakamaru Marutia.
The principle of active protection. This requires the Council to be well informed on the extent and nature of both Maori health outcomes and efforts to achieve Maori health inquiry through culturally safe nursing standards and the practice of cultural safety. Options.
Kōwhiringa.
The principle of options. This requires the Council to ensure that all of its services are provided in a culturally appropriate way that recognises and supports the expression of Maori models of care and nursing. What if on top of your job opportunities and support, you also get a range of benefits? Drake Medox partnered with local businesses to boost your health and well-being. Now you can achieve your health and fitness goals, access eye, dental and healthcare at a discounted rate. You also get discounts at home hardware stores for your DIY needs, and also discounts on financial services. We support our staff to upskill by contributing toward a training and development programme. Oh, and there's more. Medox throws a mean Christmas party, do super fun movie nights, and keeps you up to date with a periodic newsletter and recognises you as an employee. Contact your consultant today to receive your benefit card. Remember, 0800 633 699 is a 24/7 number which you can call at any time for emergencies. For example, if you can't find the workplace, if you have an accident or incident at work, or you're unable to make work due to sickness or an emergency. This video provides essential information on working with Drake Medox. Please affirm that you understand all areas in this video and that you fully understand all the information that has been covered. Wow, that was a lot. Now, how about like our Drake Medox Facebook page and check out our Refer a Friend bonus scheme. You can earn up to 250 New Zealand dollars if you refer any friends or colleagues that have New Zealand work experience who are looking for flexible hours and extra income. Once your friend has completed 100 hours of work with us, you'll receive a $250 bonus for a nurse referral and a $50 bonus for a HCA. Make sure you get your referred friend to mention your name.